Hello, everybody, and welcome to another episode of the GenoCare podcast. Today, it is wonderful to be joined by Jill Kennedy, who's a genetic counsellor in Perth in the public hospital system. And Jill has worked in a number of genetic counselling roles, both in Australia and overseas. And I've invited her along today to talk about prenatal testing. And there's a bit of a funny story for how Jill and I met, because we were at a conference in the Gold Coast many, many years ago. And I had a little misfortune tripping over on my way to the conference dinner. And at the time I didn't know it, but I actually had a fractured foot. And so I was sitting at the end of a table with my foot in a bucket full of water. And I was sitting next to Jill. We had a nice time chatting together, and as I was adjusting to the situation that I was in. So thanks for joining us, Jill.
You're more than welcome. Pleasure to be here.
So we're here to talk about all things prenatal diagnosis. And I guess what I'm hoping to get out of it for anyone who's listening is just better understanding about what prenatal diagnosis is and how it works, and why someone might come to be offered prenatal diagnosis. And I guess some of the things that they would need to be aware of if they're making a decision about whether to have prenatal diagnosis. My first question is, can you tell us a bit about your role and how prenatal diagnosis fits into your role?
Yeah, sure. So I work at a statewide service, genetic service. We look after all of Western Australia, and I work in what we call the adult and obstetric area. But essentially we deal with reproductive genetics. And the area where the prenatal diagnosis fits in is that kind of reproductive realm where people either have a family history of a genetic condition and want testing in a pregnancy, or they have had carrier screening or non-invasive prenatal testing, which have returned increased probability results, and they want to test the pregnancy, or where a diagnosis of anomalies on ultrasound have been made. And we talk to people about the possible genetic testing and what their options are in terms of testing through that process as well.
And so there's a whole range of different reasons, essentially, why someone might get offered prenatal diagnosis.
Yeah.
And so once someone's been offered prenatal diagnosis, how do you explain how it works and what the options are?
Yeah, so I guess the easiest way to do that is just talk to you like I would be talking to someone. So if someone came to me, and I guess probably the most straightforward example is if, there's a 1 in 4 chance of a recessive condition and they've known about that, I would talk to them about their options of testing, and the earliest testing that's available is via a chorionic or a CVS. At our hospital, that's done from 13 weeks, but I am aware that varies widely across providers and states. It is generally safe from about 11 weeks gestation. So it's a procedure that's performed under ultrasound guidance. So the maternal fetal medicine specialist would spend a little bit of time doing an ultrasound, taking all the measurements of the baby and making sure that everything looks okay, that there's no concerns. And then they would assess to see that they could access the placenta safely. And then using the ultrasound probe, they'd then insert the needle through the maternal abdomen and take a small sample of the placenta. I then talk about the fact that when babies are conceived, they come from an egg and a sperm, which create one cell, which then divide into 2, 4, 8, 16, 32, etc. And that a proportion of those cells form the placenta and a portion form the baby, so that the placenta actually has genetic information representative of what's present in the baby. And that sample can then be sent away to the laboratory to be tested. So they take a small sample of the villi and they can do the single gene testing as well as chromosomal analysis. They often do a little bit of a scan after the procedure just to make sure the baby's heart rate and things are fine. And some services will use a little bit of local anaesthetic on the top layer as well. Because it's an invasive procedure, there's a small chance of miscarriage associated with a CVS, and the internationally quoted statistics are about 1 in 500 when done in expert people's care who are used to performing that type of procedure. Depending on the laboratory where the testing's performed, the timeframe for results varies, but generally within 1 to 2 weeks, we'll get the single gene and then the chromosomal results back. And then the couple have options there about what to do with that information. I guess I should probably take a step back and say I always talk to people about why they would want to do the genetic test. I think we can go into that a little bit later before we kind of talk about the different options. But then the other option is called an amniocentesis or an amnio. Also performed at our service from about 16 weeks, but can be performed from about 15 weeks. Done in a very similar manner to the CVS, except instead of taking a sample of the placenta, they're taking a sample of the fluid from around the baby. And that fluid has the baby's cells from its skin cells and its digestive tract and urinary tract and those types of things. So it's a nice mix of cells. And once again, they do a good ultrasound, make sure that they can find a nice pocket of fluid from a safe area. And then using the ultrasound probe, insert the needle through the abdomen, take a small sample of the fluid from around the baby, which can then be tested, both for the single gene and the chromosome. Then they do a good ultrasound, do an ultrasound afterwards to make sure that Bub's heart rate's okay and that everything looks fine. And those results, once again, take about 1 to 2 weeks to come back. And the risk of miscarriage is slightly lower than that with the CVS. It's quoted as about 1 in 1,000. And different people choose different tests for different reasons, and we can chat about this. Yeah.
So great point, and pick up on that in a minute. So what happens after the procedure? So someone goes in for that procedure. What do they need to know in terms of sort of preparing for it and what they need to do afterwards?
Yeah, so good point. And neglected to mention that we always recommend that people have a comfortably full bladder, so a glass or 2 of water the hour beforehand. And that's just as with any pregnancy ultrasound. And we recommend that people take it easy for about 24 hours after a procedure. So no heavy lifting, no strenuous exercise. If you've got toddlers and things, talk about the difficulty in wrangling them, sitting down and them coming to you rather than picking them up and those types of things. And it's always great to have a support person with you, someone that can hold your hand and be there and that can drive you home. In terms of the aftercare, so it's something I talk about a lot, and I leave that to the maternal fetal medicine midwives, but they have a chat about what is normal in terms of cramping, and it's okay, a little bit of discharges are fine, and safe medications that can be taken to relieve the cramping, and then they also talk about when they need to come into the hospital if there's any concerns.
And so in your experience, how do people experience that process? What's it like to go through for people? What do patients tell you afterwards?
Yeah, I guess there's the physical and the emotional side that people talk about. And it's a very varied physical response. Like some people say it's fine, no worries, and other people say it's extremely painful. I, over the years, have shown, sat in on very many procedures, and I'm aware that the CVS is probably, there's a little bit of tugging associated with that and might be a little bit more painful from that perspective than the amniocentesis. But generally it's tolerated well, and which is why it's nice to have a support person. But people are able just to get on with day-to-day life afterward. Yeah, we do, there are instances where women have severe needle phobias and things like that, and our maternal fetal medicine team can assist with kind of medication support for those types of incidences as well, if needed or indicated, generally in the more severe end of the spectrum.
Yeah. And so you mentioned, the 2 different procedures, CVS and amniocentesis.
Yeah.
What are the reasons why a person might opt for one over the other? What type of factors do people consider when making a decision?
Yeah, so I guess timing is one of them. So often people won't receive, say, an increased NIPT result or a reproductive carrier screening result until they're 12 or 13 weeks pregnant, in which case through the public system it's quite difficult to get a procedure at short notice. And so they might kind of be pushed down the path towards amniocentesis. If all things, if we have the information beforehand and people are considering their options, there are different reasons why they might choose one or the other. So we often will see people who have a chance of 25% of having a child or the pregnancy affected with the inherited condition, or a 50% chance, and they want that information as soon as possible. And they are aware that this is a relatively high chance of needing to proceed or electing to terminate the pregnancy. And so they choose to get that result or have the testing sooner rather than later.
Yeah.
And the miscarriage risk is less of a consideration for those couples. Other couples where they have like a less than 1% chance because of a phenomenon known as gonadal mosaicism, which can occur when something's happened in a previous pregnancy for the first time and they essentially want reassurance for this pregnancy. They elect often to have the amniocentesis because it's slightly safer. The chance of it happening again is low. And so they're more comfortable waiting for that time. And of course, this is, they're very big generalizations. There are people who are super anxious about that less than 1% chance and want that result as soon as possible. So they're, big generalizations. I guess the other thing to consider is if the couple are electing to end an affected pregnancy, then there are differences in how a termination is performed at different gestations. So we would chat through those. So that often can be part of the decision-making process for families. And then I guess if we're thinking about chromosomal conditions, I did mention when I was talking about CVS that the placenta is representative of what's happening in the baby. I guess one situation that is not the case or may not be the case is where the placental tissue may have a difference in the chromosome makeup compared to what's going on in the fetal tissue. And in that instance, that's a phenomenon known as confined placental mosaicism. And in that instance, an amniocentesis would be indicated. So I guess an example of where we might be thinking that is what's going on is if a couple have had whole genome-wide NIPT and they find like an unusual trisomy, 11 or something like that, yet the pregnancy is ongoing and the baby looks well and everything's developing fine, there's a possibility that that's just present in the placenta and not the baby. So there would be, I guess, obstetric things that we'd need to think about for the monitoring the pregnancy later, monitoring the placenta later in pregnancy, but an amniocentesis would give us a better read of what was happening in the fetus rather than the placenta.
So as a genetic counsellor, you would consider each case individually and offer, or I guess go through the different considerations about each procedure and the pros and cons of each, tailored to that patient situation.
Yeah, definitely. We get a bit of a read on how they're feeling and their anxiety levels and what information will be useful to them at what time, and then talk them through the different options and the pros and cons of each with their specific situation in mind. Yeah.
And so it sounds like there's some considerations around what the best procedure is going to be, what individual factors the person and their partner potentially are thinking about. And then there's a decision made about whether or not they want to have that procedure. We talked about then how the procedure is performed. And so you mentioned different wait times for results, but what happens once the procedure's done? So the person's had the procedure and they're waiting for their results. What happens then?
Yeah, so they, in terms of support, is what you're asking?
Yeah, like just what would someone expect once they've had the procedure? Yeah.
Yep. So we generally follow up a few days after the procedure just to see how it all went and how they're coping. We try and do a bit of preparation before the procedure about the anxiety, that time frame, because that is often, once they've made a decision to have the test and they know what they're going through, it's often that waiting for the results, which is the most anxiety provoking time, because they know that those results are there and they're going to come at any time. And so we would have hopefully put something in place and explored the couple or the woman's coping mechanisms and supports, and hoping that they are, not resorting to, but engaging those as they need. And we're always available at the end of the phone if, they're feeling like things are spiraling or they're not coping or they just want to check in and see where the results are at. The way that we give results, and I suspect this is a bit service specific, but where I have worked, it seems to be pretty standard, is that we'll make a plan with a couple on how to give those results. Often that either a telephone call as soon as they're available, or I feel a bit old team this, but with emails and things, we able to email them and say the results are available. When would you like me to call? So they can have a place where they are safe or they're together, those types of things. And that would have all, and something I haven't mentioned is that we'd go through a consent form about the testing. So that would have all been covered in the pre-test consent and counselling. Yeah, but we do try and be available for couples because we do know that it is a tricky time.
Yeah, absolutely. And so when you are giving the results, as a genetic counsellor, how do you approach that?
I was just thinking about this last week, about how we prepare differently for different phone calls. And I would hope in these settings that I would have a bit of a relationship with the woman. And so we would know each other and they wouldn't be expecting my call. It's a very different scenario to calling someone cold and saying there's been something found. So, and I always start the call with, "It's Jill, I'm phoning with the results. Is now an okay time to have a conversation?" I never just launch into it. And I always prepare people that that's what I'm going to say. And that doesn't mean that it's good news or that the result's positive or negative. It just means that I want to make sure that they're aware and they're able to listen. They're not driving the car and those types of things.
Yeah.
And then, presuming they say that they're happy to receive that information, I will just say the results come back showing that the baby does have the condition or the baby doesn't.
Yeah.
Just really straightforward. Don't mince my words. And, then the conversation can be very long or it can be very short. Often it's very short and people say, "Thank you very much." And we make a plan that we'll be in touch as needed. Or they say, "Thank you. I wasn't, I knew this was a possibility. Can you facilitate termination or management or whatever needs to be done?"
And what happens if they're not sure what choices they want to make? So because I guess in my experience, sometimes people are very clear. Other times people sort of haven't actually thought through the possible outcomes, what happens in that situation.
Yeah, I always find that a little bit tricky, and try and head that off at the pass and hope that couples do have that conversation and that's part of the pre-test counselling, is talking them through those. If the results comes back as that the fetus is affected, have you considered what you do, and try and get them to get that conversation up and going. If they don't know, I'm happy to see them again and talk them through that, provide them with more information about the specific condition if that's what they need, or about the potential treatments, about prognosis. And if they are still unsure and want to speak to specialists in the fields, we've got the capacity to do that as well. Yeah, I guess that's more likely to happen in a setting where it's reproductive carrier screening. It's all happened quite quickly.
Yeah.
Rather than there being a family history or them having had an affected child or pregnancy in the past. So we would ideally help them get that information before they're at this decision-making time, because once you've got a result, and I often say this to couples, is that I would encourage you to think about this now and have this conversation, because if you get a result and it shows that the baby is affected, then there is a whole lot of heightened emotion and it's more difficult to think about things, I guess, clearly. And so if with a decision that you make now, doesn't mean you have to stick with that, but if you'd kind of thought through all the different options, then at least you can kind of look back on that and say, well, this is what I was tending towards. Why was I tending towards that? And it's changed if something has changed.
And perhaps it's having a plan gives them a sort of framework to lean on once they're in that situation, which can be very overwhelming.
Yeah, definitely. I don't know that enough can be said about the importance of pre-test counselling and conversations about, I guess, all the different possible outcomes and what that might mean to them and how they might interpret that information. And we'll do the single gene testing when there's a single gene condition, but we also do chromosomal testing, and it's talking to them about the possibility of that showing something that we're not expecting. So, and I think a lot of the best case scenarios are the ones where people have had the opportunity to consider things before going ahead with the testing. And that's the role of genetic counsellors. And I would encourage referrals to genetic counsellors or other allied kind of health areas, health providers sooner rather than later, so these things can be discussed.
So I think that's a really important point. What do you want other practitioners to know? So those who aren't as experienced with the process of prenatal diagnosis.
Yeah.
Maybe people who are referring into you or to your service or to a genetic counsellor. What is helpful for practitioners to know about prenatal testing, and how can they prepare their patients for seeing a genetic counsellor where they're going to be offered prenatal testing?
I think if they're aware that there are options available and a bit of an overview of, as early as 12, 13 weeks, and that there are pros and cons, and that there are people who are educated in this area and experts in this area who can talk that through. And you don't need to make a decision by yourself, I think is really important. And whether that's us as genetic counsellors who do that, or the maternal fetal medicine midwives who have those conversations. It's not just genetic counsellors who have that information and expertise. And I would also encourage providers to contact us if they've got questions or they're not sure. So once again, I'm speaking for Western Australia, but I suspect it's the same across Australia, is that we always have a genetic counsellor who's on call during business hours, Monday to Friday. And if they are not sure, or if they have questions, to give us a call and we can chat them through those options. I had a GP call me last week and she said, oh, look, I have a woman who's a premutation carrier of Fragile X. She's 9 weeks pregnant. She's going to come in and be very worried. How do I approach this? And how do I lay out this information for her? And what can I tell her? And I'm more than happy to have those conversations and chat that through, and then refer it to us, and we can go into that in more detail. Yeah. So don't be afraid to ask the questions. We would prefer that than misinformation being given to patients, or anxieties being raised, or couples being offered one thing and then when the genetic counsellor assesses the situation, realising that actually a different option might be more suitable.
And you touched on something else earlier that I think is really interesting, and that is people's prior experience of the genetic condition. So you were talking about how with genetic screening becoming more commonplace and part of mainstream healthcare, we are seeing more people who haven't encountered the genetic condition before in their lives finding out that they actually do have an increased chance of having children with that condition. And And that creates a different decision-making context to people who might have had a family member with a genetic condition, and they know that they have an increased genetic chance for that condition in their own children. They've often had time to think about whether they would want to have prenatal testing and to think about what kinds of decisions they might make. So I was just interested in your reflections on how that shifted throughout your career. I think you probably would have seen initially more people in the category of having that familiarity with the condition, but now increasingly seeing people feeling quite blindsided by a genetic testing result and having to adjust and adapt to that news in a really quick time frame.
And you're right, it has changed significantly. And the onset of reproductive carrier screening, we used to always just do cascade screening for couples if there was a family history of a recessive condition. And they, because we couldn't test everybody, they would have to kind of have a certain level of risk before we'd offer screening. And now as reproductive carrier screening has become available, it's open to everyone, and the responses are wide and varied. I've noticed or I've experienced a number of couples who don't actually believe that it's real until they have had a positive result, like in the pregnancy. So they might come back as them both being carriers, and it's not until that result comes back showing that the baby has inherited both the variants that they're like, oh, we didn't actually think this was going to happen. And then we have couples who might be overly concerned about a condition that might be relatively mild or manageable. And whereas a couple who've had a family history of a significant condition might think that isn't such a big issue compared to what they've experienced in their family. So it really does shift, and it's very person or couple or family specific. And there's people don't respond in the same way, and they don't respond the same way in subsequent pregnancies either. So it changes over time once they've got more information. And often with the reproductive carrier screening, people are initially really anxious and heightened stress. And when we're able to actually talk to them about, I guess, the realities or the numbers and the specifics of that condition, often they are able to bring that anxiety down some. And I guess in that setting, I'm thinking of specifically Fragile X syndrome, where there's often women are getting increased probability of results and are told that there's a 50% chance that the baby will have Fragile X. Whereas in actual fact, when we look at the premutation size, that is maybe less than 1% chance. It's definitely, I don't know that I've been particularly eloquent there, other than to say it's been a really changing landscape, and it's very couple and situation dependent. For example, I had a couple who had multiple pregnancy losses and fell pregnant via IVF, and then found out that they were both carriers of a condition, and the pregnancy was too precious to them to consider testing for the condition. And so lots of different things come into play, not just experience of the condition, but their reproductive journey to date, what their beliefs and values and feelings are about intellectual or physical disability all come into play. And they're the types of things that we try and help couples to take on board and consider in their decision making.
I think what you've just beautifully done answering that question is highlighted the really important role of genetic counsellors in helping people navigate their prenatal testing options. Because genetic counsellors have, over the last couple of decades, really witnessed this really significant change in access to testing and have seen a high volume of people navigating this. And so have that depth of expertise and understanding how people respond in different situations, what kind of considerations are important to people, and what other factors people need to take into account. And so that's why it's so important when someone either does have a family history or something comes up on ultrasound or something comes up on genetic screening, that people are referred for a genetic counselling appointment so that they've got a genetic counsellor to go through what the results mean, what the implications are and what the options are, and then to support them, as you've so beautifully described, throughout the whole process to try and give them a space where they feel understood and they can make informed choices and they feel well supported through a time that can be really quite challenging.
And they push down one pathway or the other, that the decision is theirs and that we help. So you talked about what the results mean, and I guess what the results mean, but what the results mean to them is that really important thing, is that I can say what a result might mean to me, or maybe not because I've not been in that situation. What it means to them is going to be very personal.
And I think that's a beautiful, I guess, point to end on, is that, the support that genetic counsellors provide is, as Jill described, very much tailored to the individual situations. But a genetic counsellor will never tell someone what to do. A genetic counsellor is just there to help them understand the information and their options, and then to be a sounding board to help them identify a pathway that feels right for them.
Yeah. And it's a privilege to be able to do that. Yeah. Very lucky to do what we do.
And I think people are very lucky to have you doing what you do. So thank you so much, Jill. I really appreciate you going through what prenatal testing is and how it works and what the experience is like. And I hope that's been helpful for our listeners. So thanks so much for joining us.
You're welcome. I also hope it's been helpful.